When talking about the economic analysis of surveillance, usually it's a good idea to remind ourselves what economics is and what it does as a discipline. When you think about animal production, we use water, feed, land into an animal production process with the aim to produce goods and services in terms of food, income for people, livelihoods, but also companionship or protection. So in other words, we're using resources to produce goods and services that people demand and consume. And so we are creating value in a production process, and we have resources which are our means to create a value. If we introduce disease into this system, we are losing value here. And this value loss is an economic cost. And what we then use, we use more resources to compensate for that. So we use surveillance and intervention resources to avoid this value loss, and that's another economic cost. And the big question now is, how do we find a balance? How do we make sure that for the resources we invest, that we create value for money? And in economic evaluation, because it is about resource allocation and taking a decision, we always are comparing at least two alternatives to be able to make a choice. And for the two alternatives, we are looking at what goes into the system and what is coming out. So what are the inputs and what are our consequences. We do identify these things for both the alternatives and then analyze them and put a value on them. Traditionally in health economics, we would then look at what is a full economic evaluation, where we are looking at two alternatives and also both the inputs and the consequences of the alternatives. So if we do that for both, yes and yes, we get into the area of cost effectiveness analysis, cost utility analysis, cost benefit analysis, optimization analysis, and a slightly special case for surveillance, least cost analysis would also fall in this category. If you think about the disease losses that we see in a population in relation to the expenditure and reaction to the disease, we can formulate a technical relationship between the two. And a veterinarian would always want to be here. We want to reduce disease as much as possible because we think it's good to have a healthy animal. And also many epidemiologists think like that. When we think that it's good to get rid of disease at all cost. But then when we think about the economic considerations, so we here can, for example, introduce a cost line where we have along this line the costs are always the same. We can then identify a point in our system where, from an economic perspective, we would have optimal control. So here we would have no control and maximum disease losses. Here would be optimal control, and that is where veterinarians usually would like to be, invest a lot to get towards eradication. Now, keeping that in mind, what is so special about surveillance? The special thing is that surveillance is, as we heard this morning from Häsler, is a tool for disease management. With surveillance only, we will not have disease avoidance. We need intervention in the system as well. So surveillance, in the end, provides information for an intervention to control or manage the disease. Therefore, we are looking at a three-variable relationship. So we're looking at surveillance plus intervention that then leads to loss avoidance, and we want to optimize this combination of surveillance, intervention, and loss avoidance. And to do that, we need to think about the relationship between surveillance and intervention. Are they economic substitutes? That means, can we use more of one to use less of the other one? And intuitively, that is what we believe. That's why we say we use a lot of surveillance to early detect disease, and then we can avoid all these outbreak losses that are coming later. Or are they complements? When they are complements, they would always go together, so we always have them, use them in the same ratio, and then they could be considered as one package together. So what is the value of this information that we are looking at, this information that is used to inform disease management? This is something that we are constantly thinking about, and we're trying to put a value on that. And therefore, we need to look at the loss avoidance in the system. If you look at that from a national or sectoral viewpoint, we can plot a situation of disease losses over time following, in this case, an epidemic curve. Here, these would be the disease losses that we see if we don't do anything about the disease, and with control, the line would look like that. And now we are interested in the amount of the losses that we can avoid. That would be the area between two curves, this red area where we see the avoidable losses. And that is something that often gets forgotten, that we, even if we have control, we may still have some losses. So we're interested in the amount of the losses that we can reduce. If we plot this area in a different way as a benefit over time, cumulative benefit over time, then we can think about what resources do we need to achieve this benefit. And here it's just a hypothetical example. Our intervention costs over time, again cumulative, they may be higher than the benefit, so that would not be a cost-effective way of controlling this disease. And then surveillance costs on their own, they may be lower than the benefit over time, but together, in any case, the total control costs would be much higher than the benefit over time. There are many situations where this would look totally different, but I just want to explain the basic principle. So if we keep this in mind and think about our surveillance, the information it provides for intervention and loss avoidance to happen, in a cost-benefit analysis, that is exactly what we do. So we're looking at what is our loss avoidance, what are the surveillance costs, what are the intervention costs, and in the end, do we have a net value for money expressed in monetary terms, for example, in pounds or euros. We know how to do that conceptually. It's possible to do, but it is very, very time and work intense, because we are looking sometimes at very complex disease dynamics, and we need good epidemiological models to make predictions about what will happen with or without our control over time. So conceptually, it's straightforward, but effectively doing it is a lot of work and very data intensive. That is one of the reasons why people are looking for shortcuts. And that's where cost-effectiveness analysis comes in, with the expectations that we just look at, for example, the increase in cost in comparison to the increase in sensitivity or timeliness, to know what our value is for money. But as in cost-benefit analysis, we should know what our effectiveness tells us. So as I said, these are common effectiveness measures that we see in cost-effectiveness analysis for surveillance, sensitivity, timeliness, probability of detection, and robustness. And I would just like to give you a second to think about what is their value. Do we know the value? If you say, what is 1% increase of sensitivity worth? Or what is 1 day of early detection worth? Or what is a 5% increase in probability of detection worth? Can we tell? Can you tell? I see some people shaking their heads. So when can we use cost-effectiveness analysis? When is it useful? It is very strongly context dependent. And it is clearly suitable for the big four, as I call them, like avian influenza, FMD, CSF, and ASF, in our context in Europe, where we have clear contingency plans in place, and we know if something like that occurs, that the impact is potentially very, very large. That's why we can justify to have high investment into surveillance to early detect these diseases and react appropriately. Then the other case I would say where it's suitable is where we have a situation from freedom from disease, where we have a benefit in terms of trade. So if a country is able to trade because of demonstrating freedom from disease, then again we have the same situation, that the benefit resulting from trade is so large that the investment into surveillance is justified. And the same logic applies to potential pandemics, and in some cases, so-called given surveillance that is clearly stipulated by legislation and it has a trade impact. For the other cases, it could be potentially suitable for situations where we can establish a correlation between this effectiveness and the final benefit. So if we collect enough empirical data to demonstrate that, for example, 5 days early detection results in a benefit of £500,000. If we can establish this correlation empirically, then in the future we can use the proxy measure instead of doing the full calculation. Then we also have situations where we see that the minimum target effectiveness is given, and it is defined by a government. And if we do not want to question this target effectiveness, then we may also say we accept that as a given, and we look at situations, or we look at ways of how we can minimize the costs and do a cost effectiveness analysis. And with that, I end my part and I will pass on to Alexis.
Thank you. Okay. So now that we have talked about the national viewpoint of the value of animal health information, now we know that private actors, what we call end users of information, may also actually want information, desire information to help their decision making. So this question can be addressed in three following points. So first, who needs information and for what? We need to clearly identify who are in need of information. Then, how do these end users value information? Could we actually quantify in economic terms their demand of information and integrate it in an overall economic evaluation framework of surveillance? Then finally, from which sources this information is obtained? This information could be obtained from a public surveillance, but it also could be obtained from other sources, and we need to establish it. So to provide a beginning of answer to how could we address these different points, I propose you to move from Europe to Asian country, which is Vietnam, where we conducted a survey in 2012-2013. So the first question was, who needs information for and for what? So this survey was targeted at the different private actors that could potentially be in need of information, and we progressively identified these actors that were animal producers, but also animal traders and feed industry and the different actors of the upstream sector involved in the input supply. And we might need information for, of course, avoid production losses due to disease by adapting their prevention attitude, their prevention behavior, using disinfection, vaccination, quarantine, or by, for example, selling earlier or later their animals. But we might also be in need of information to anticipate market impact and to adapt their marketing strategies. So after this question, we built an econometric tool based on contingent valuation to try to give an economic valuation of their need of information, how this sector might value one animal health information. So the first step in this tool was to ask how much losses produced, because we target producers to assess this tool, but how much losses producers could avoid using animal health information. We made the interviewee reflect about this question first. Then we built an hypothetical scenario where an industry, an imaginary industry, would actually sell animal health information to producers. So only information. Then we asked interviewee to try to figure out a price that we would be willing to pay for such a private service. And so we made a pilot test on a sample of broiler chicken producers of Vietnam, and we obtained a median value of their willingness to pay, of the price we were willing to pay, and it was about 1% of the chicken market price. So, but then the final question was also from which sources this information could be obtained. We knew that there was a demand. Now, how this demand was fulfilled. So we used for this SNA methodology, a social network approach, to get a representation of the network of actors, public or private, that were involved in disease outbreak information transmission. And we saw that actually the poultry farmers received their information from private actors, and that the most central actors in information spread were the poultry. You can see a little bit on this diagram: poultry farmers, feed sellers, veterinary shop, poultry traders. So a network of private actors that actually fulfilled these demands of information. And part of the reason of this result is that there are a strong disincentive to transmit information to veterinary authorities. So now we're moving to the discussion. So, like Barbara emphasized, so there is a full economic evaluation of surveillance requires an appropriate protocol. It's like really like in epidemiology, there are protocols, there are established rules for making economic evaluation. As economic evaluation is about informing resource allocation, it's always about informing a choice made between different alternatives. So counterfactual is always needed in an economic evaluation, and this counterfactual is there is always at least one choice that is hypothetical, that has not been made before. That is so that we compare with other alternatives. And the difficulties are there are three variables, like Barbara said. There is so the benefit of surveillance is loss avoidance, but surveillance itself is pointless if there is no mitigation measures. So there are three variables: investment in surveillance, intervention, and loss avoidances. As there is always a counterfactual and at least one alternative of the choice is hypothetical, there is a need to model the effect of this choice. So using modeling, taking into account disease dynamics, human behavior, and to establish the potential outcomes. And information value, as we have noticed, depends on the viewpoint and the socio-epidemiological contexts. And there is an important need to assess the existence of a demand of information from the end user and the level of this demand and the implication of the private sector. So now we are expecting any question.